So I have to do this from the bathroom because my children are very loud and noisy, and the only place I can have a little bit of peace is in the bathroom when I lock myself in there. In here, they're out there with grandma. I just wanted to share my experience today. So I'm feeling like crap, super tired, not feeling well, head hurts, body is in agony, nothing I take is working, and I'm super moody and irritable. Everything is bothering me and I just want to like be alone. I find myself screaming a lot, which I don't want to do, but I'm irritated, like I'm in pain, and I just want to lay down and watch TV and not be touched or spoken to. And that's kind of hard when you're a mom and you have kids at home and it's not their fault, so you don't tell them how you feel because you don't want them to feel like they're the ones bothering you. It's not them, it's the pain that won't go away, the pain that is harassing you, tormenting you, mocking you, and it's just, it doesn't go away. It's attached to you, and it sucks your soul out of you. It sucks the happiness out of you, and it turns you into this irritable, screaming jerk that you don't want to be. I remember a happier Kim. I am in agony. Everything hurts. My shoulders, the center of my back, my lower back, my legs, everything. My head, my hair. I feel like I'm losing my mind. I went to my general doc today because something's been happening to me for the past 2 weeks. Every time I get into my car to drive, I don't know if they're anxiety or panic attacks, but I'm driving like 15-minute drive from my house to Walmart because I can't drive more than 20 minutes without feeling dizzy and feeling like my legs are gonna cramp. So my little 15-minute drive to Walmart, and my heart starts beating like I'm running a race. My head starts sweating. I feel dizzy and overwhelmed, like impending doom, like I'm going to crash or something horrible is gonna happen. And I feel dizzy, like I'm gonna pass out. It happens to me every time I drive now. That never used to happen to me. I've been driving since 2000 and I want to say 2008, 2009 I've been driving. So about 10 years I've been driving, and I mean, I'm talking about driving in New York City. Crazy driving. Drive like a taxi driver. I drive like a taxi driver. And now I can't even drive 12 minutes on local streets without feeling impending doom. So I go to my general doc today, and it was like the most horrible experience, right? So she walks in the room after making me wait 30 minutes in the empty office, and immediately she's like, hi, I didn't get to go through all your records. This is my second time meeting her. I didn't get to go through all your records because it's like a book. And she said it with kind of with an attitude. I didn't say anything. She starts just running her mouth about all the reports she's receiving from all the many doctors I'm seeing. Yes, I'm seeing a lot of doctors. I'm seeing a neurologist, a neurosurgeon, a rheumatologist, a hematologist, a pain doctor, and her. Why? I have a brain cyst, a 4-centimeter brain cyst that's causing me issues. I'm having memory issues, speech issues. I have severe head pain, burning pressure in the back of my head. I have a left temporal arachnoid cyst. So I'm seeing a neurologist and a neurosurgeon for that. I'm trying to figure out if I need brain surgery or not. So I also filed for disability, so she is gonna get paperwork. And we went through everyone I'm seeing. She goes, "You're still on all those pills?" Very unprofessional. No, I'm not on all those pills. I'm on Tramadol for pain, Flexeril, a muscle relaxer, and gabapentin, which I'm gonna stop. I was on 100 milligrams for a month. Then they upped me to 900 milligrams last week. It was too much for me. Very tired. I can't be that tired. I have a 2-year-old. So I decided I wanted to get off of it completely. I talked to my pain doc. He said, you have to come in and see me before you can do that. So I go in and I'm going to see him next week. So I decided to drop it myself. Now I'm up to 700 milligrams a day. And I'm going to keep dropping it until I see him, because I don't like the way it makes me feel. That's all I'm on. And iron pills, B12, and folic acid. That's it. So what is she talking about all those pills? Second offense. Right? Then she starts going on and, well, I don't know what's going on because I spoke to the neurologist and he said your cyst has been there for over 10 years, it's stable, and, you know, nothing really wrong. I said, okay, well, I'm telling you, because, you know, I'm the one with the cyst in my head, that I have head pain every day. I feel like someone's sitting on the side of my head. And then I have a burning, poking pain, along with memory issues, and I'm stuttering. I've never had a problem with speech in my life or with memory. How would I have been able to get my master's degree if I'm having memory issues and I can't retain anything I'm reading or pass an exam to get my degree? This is recent. I told her this started in January, where I'm having these memory and stuttering issues, and when the pain in my head started, yes, I've had this cyst my whole life, but as of this year is when I started to have the problems. I don't know why. She then goes on and says, listen, you're so young. Why are you seeing so many doctors? Stop worrying about anything in your head and any pain in your back and just live your life. She told me to stop worrying about anything in my head and the pain in my back and to live my life. How would you feel if someone told you, forget about the pain that you're in and live your life? She made me feel as though everything I'm telling her is in my head. She said, stop worrying about anything in your head. I felt like crying, and at the same time, I felt like choking her with her stethoscope. So, after that, I looked at her and I said, yeah. So, again, if the cyst is stable, why am I having memory issues and stuttering issues? She looked at me, she said, I don't know, but get up on the exam table so I can examine you, because I have a patient waiting. So I get up, she examines me. I told her, you know, the real reason why I came here today is not to go over all these things, but to tell you that recently when I'm driving, I'm having all these symptoms, you know, sweating, heart beating real fast, feeling dizzy, a feeling of like I'm gonna crash or I'm gonna black out. And she looks at me, she goes, oh, sounds like a panic attack. You need to see a psychiatrist about that. Well, come on, follow me. I'll see you in 2 months. And that's how she ended the visit. I will never, ever return to Miss Yvonne Beckett, medical doctor in Tamarack, Florida. She works for Medical Care Associates. I will never return to her. She's very unprofessional, very unethical, and has no empathy or compassion whatsoever. I noticed that most of the patients sitting in her waiting area are older, senior citizens, 60s, 70s, and above. I've never seen, you know, well, only the 2 times I've gone, a patient of my age. Maybe my situation is too complex for her. You know, all my medical records to her is a book. So I will be finding someone else. I feel very defeated, very unheard. No, it's not all in my head. It's my body. I know how I feel. What I'm going through is real. So, you know, coming home after such a horrible visit and then just continuing in pain, knowing that I have to continue driving places because I live in Florida, you need to drive, and that this is going to happen every time I drive. I have to drive to my doctor's visits. There's no one else to take me. My husband's working. My mom who's visiting doesn't drive. It makes me feel just angry. And so, you know, I don't really get much rest at home because I have 3 kids. My 12-year-old is in New York with family visiting. He's coming back mid-July. But my 6-year-old, my 2-year-old, they don't sit down. They don't stay still. They argue and fight and scream. And they're very needy. You know, they need me to do this, do that, listen to this, listen to that. And it's okay because they're 6 and 2 and I know they need me. But I just need a break. I am tired. And I'm feeling like an irritable jerk today because I've been screaming a lot. And I just don't like how I am right now. And I need some type of relief from my pain. I need a break. I've asked my mom if I can spend a night or 2 in a hotel before she goes back to New York just to like breathe. Because I'm always with the kids. And if I'm not at a doctor's visit, I'm home. Pretty much. So yeah, I just wanted to share. I don't know if there's any of you out there feeling kind of anxious and irritable. If the pain makes you angry, because it makes me angry. Because again, it is a soul-sucking, mocking, relentless pain that attaches itself to your body and it doesn't let go. And a lot of people around you can't understand why you're angry or why you're sad or why you just can't do much. Just can you imagine this invisible being just grabbing onto you all the time and doesn't let go? What do we do? This is just a day in my life. Anyway, we carry on, right? Because we're warriors. Till next time.